If you are diagnosed with high blood pressure, there are a few ways most doctors will tell you to treat it. Lifestyle changes, medication, and using a blood pressure cuff.
Well, doctors at Sentara are looking for ways to improve that care plan, and they're hoping to help people in underserved communities while they're at it.
Keeping hearts healthy and increasing health equity. Those are the two goals of a new research program at Sentara.
We want to save lives. That's the bottom line. How do we save a life? Well, we have to save a life by identifying there's an issue and addressing that issue.
And in this case, the issue is hypertension or high blood pressure. The CDC says it impacts 47% of American adults.
I don't want to see our hospitals overrun with heart failure patients because of just simple blood pressure control.
Dr. Keith Newby is Sentara's medical director of health equity. The health equity team and Sentara's research center are about to embark on a 5-year research study focused on hypertension.
It really fits in with what Sentara was already doing. That is trying to reach out to the community and engage the community better.
Dr. John Brush is Sentara's chief research officer.
So it's going to be $3.4 million that is coming our way.
That grant is coming from the Patient-Centered Outcomes Research Institute and is in partnership with Yale University, Massachusetts General Hospital, and Houston Methodist Hospital. The first part of the study is finding people in underserved communities who need care and may not have access to it through community partners.
Already, Sentara is reaching out to community-based organizations like churches and homeless shelters and food banks to try to find patients who are vulnerable or who have untreated health problems.
Then the patients will be broken up into 2 groups. One group will have a remote blood pressure monitoring system that sends data to Sentara.
Essentially devices that allow them to not only just check their blood pressure but also record them and they have access to it where they wouldn't have that otherwise.
The second group will also have that technology plus an additional resource, health workers who go to their homes to check on them.
That's where that community health worker comes in. They can identify those early problems and try to give them that information and help they need.
Their goal is to find the best way to treat high blood pressure.
Because ultimately what we're hoping to do is to reduce the number of people who end up having strokes and heart failure and renal failure and all those complications of hypertension.
And in doing that, they also hope to increase health equity and save lives.
So what I would like to see is 15, 20 years from now, we're seeing less people in dialysis centers, less people in the grave early, less people with heart failure, and that to me is the goal.
Researchers are looking to enroll about 480 people in this study over the course of 2 years. If you are interested in participating in this study or know somebody who would be a good candidate, contact the Sentara Health Research Center. That number is on your screen, 757-252-3281. We'll also post this information over on wavy.com.